Locality working for me is the way that Tamworth Borough Council works out in the community. It's not an initiative, it's not a project, it is quite simply a way of working.
Locality working is specific, as the name suggests, to particular areas. In Tamworth it's based in Amington, Belgraves, Glasgow Heath and Stony Delph, and it's all about working together with partners and services to deliver to local need.
We've established community hubs that we use as a focus for this work. As well as people working in the community, we have buildings and facilities in the communities that can be used to support service delivery.
When you're in the locality, when you're on those streets, when you're in those neighbourhoods, you can gain the trust of people. You know, you're in there with them. You can find not only the problems, not only the issues, but I would say most importantly the opportunities.
Community hubs or arches are buildings located in the heart of local communities. They provide flexible space which allows agencies to deliver services to people in most need. It's a place where residents can come and seek support and advice from professionals in their community, away from Tamworth Town Centre.
A community hub is a safe place for community members to work together with partners or to access services. So it can be in the shape of a building or a community room, a local fire station, for example, and where it's a central point, so community members can access it whenever they need.
The community hubs were established really to be a place where partners can deliver services and also a place where the residents know they can go to access services or find out advice and information.
Individual people and families need discrete opportunities, whether that be in terms of time, whether that be in terms of a service or whether that be in terms of space, to be able to sit down, explain their problems, in a comfortable environment that's not too far away from their home, and in the knowledge that those people who are delivering the services are there on the doorstep, able to help them. Very often something that prevents people accessing services are basically around three things. One is transportation and the cost associated with that. In other words, they have to pay to come in and access services. Two is around childcare, and the third one, and perhaps the most important one, is that sense of security. They feel a lot better in their own community communicating with us as service providers.
The community hubs can offer a range of facilities for partners as they're a visible and signposted location. Inside each hub there's a reception area, hot desking space, meeting and training rooms, as well as private and confidential space where partners and clients can work privately.
Use the arch because it's in the locality of the clients that I'm working with. Whereas I'm attached to the GP surgeries, it's nice to have a bit more of a relaxed atmosphere, which you get from the arches, and it's just very convenient for people to attend.
Because it's in the heart of the community, basically. We're set up in GP practices and also in hospitals. But obviously there's a lot of people that can't get to their GP practice, so for a lot of the clients that I see here at the Belgrave Arch, they're within walking distance, so it's more convenient, they're more likely to turn up for their appointments, and personally I feel that I get a better service out of them a lot of the time because they'll open up more.
They're more helpful for people sort of out of town areas, because I can sit here, I've got the laptop on mobile, I can do all the advice things here that I can do working from the shop in town, and it's just based on people's locality, and if it's easier for them to take a quick 5-minute walk after they've dropped the kids to school or whatever, and obviously it's a lot more confidential as well. People can walk in here, we can use a small confidential room and nobody knows what they've come in here for.
People don't always want to go to the police station, do they? You know what I mean? And as a police officer obviously that has impacts if it's just that they need to be spoken to, or they want to talk to you about something specific and they don't want to, it's not ideal to do it out on the street, or it's not ideal for you to go to their home, then you can do it here, and it's an area that, it's common ground.
There's a wide range of partners who use the hubs at the moment. Some people use it weekly for advice sessions on a regular basis. It's used for training. We've done training from security training to training volunteers. It's used for community meetings such as PACT or residents groups. So it covers a wide variety of issues. We've got around 30 partners and organisations who are with us at the moment.
We can provide agencies with knowledge of the area, statistics, and also point them out to key people in the area so they can work on projects jointly. Joint working is a particularly important thing, especially in Glasgow Heath where I'm working, where there are a number of partners already there, and working together is key to improving things in the area.
It's important to work with the agencies because they're the professionals that deliver the services that the communities need. We identify what services are required in a particular area, and if the service is directly in with the community, then they get a better feel of what the community wants, what they're after, and can work alongside the community and get better advice from the community to deliver a service exactly tailored to their needs.
The future locality working is the exact model we have now. It's just getting more and more engagement from more and more partners, such as, you know, the NHS and others, and getting them into our community hubs, the arches as we call them. Basically all of local government, all of the public sector working out of one place in the locality, offering a one-stop shop of public services to the community, and that community responding to those services that are available.
Having more partners involved would benefit locality working because it means the people who need the services the most are accessing the services, and usually people who require services need access to more than one service, and the services will be communicating with each other to ensure that the best possible service is provided to them.
The benefit for partners is that they can have a focused approach in areas where they know that other partners are willing to work with them. They may not be able to deal with a project entirely on their own, so there are other people with different expertise who can bring that to bear, and working jointly means they can have a better effect. Also, the benefits could be that through locality working, they meet other partners, meet other organisations, and form new partnerships and new relationships that can help them address problems that they wouldn't even have thought of addressing on their own.
I think there probably should be more of these kind of places, really. Because the other thing is that a lot of our clients, they come with a drug problem, but once you get talking to them, you realise they've got childcare problems, they've got debt problems, they've got mental health problems. So if you can have a focus in the community where all the other community groups and support services can come to, so clients only have to come to one place to see everybody. That's the ideal scenario. So the model, I think, is brilliant.
For more information about locality working or how to get involved in your local area, please visit the Tamworth Borough Council website, which is www.tamworth.gov.uk. Once you're on the website, click on Community and Living and then select Community Development. From there, you'll be able to access extended information and resources about locality working in your area. Alternatively, please do pop into your local community hub where you'll always get a warm welcome from the local community development officer.